The first question my patients ask me always when they get diagnosis of epilepsy is, Doctor, why do I have epilepsy? What causes my seizures to happen? Or why my child has epilepsy? So today we will discuss all the different causes of epilepsy and why you might be having seizures. There are many different causes of epilepsy and seizures. Epilepsy in general is a condition when somebody has spontaneous seizures and there is excess electricity in the brain that leads to seizures to happen. It is important to realize that epilepsy can be a condition by itself, or it can be part of other symptoms and conditions such as an epilepsy syndrome or a genetic disorder. Everyone can have seizures and epilepsy. Do you know that 1 in 26 people can have seizures in their lives, and 1 in 100 people can have diagnosis of epilepsy at some point in their life? Think of the brain as a huge plant for electricity. It is full of wires and connections and hubs. And then anything that can go wrong in any spot in this process, it can lead to abnormal electricity and leads to seizures and epilepsy. The International League Against Epilepsy made an excellent effort to categorize all different causes of epilepsy, and this is what we will be discussing today as well. So epilepsy can be caused by genetic, structural, metabolic, immune, infectious, or unknown causes. Let's take them one by one and explain more. First is genetic cause. So genes are responsible for building blocks of the brain, and the genes can control the electricity flow by controlling the channels and receptors that control electricity in the brain. Sometimes there is one gene that is responsible for electricity that can go wrong, and then there will be increased excitation in the brain that leads to seizures. The genetic disorder usually cause generalized epilepsy because of the affecting the build of the brain. And classic examples can be juvenile myoclonic epilepsy, and sometimes it can cause focal epilepsy. And it is important to realize that sometimes one gene can cause multiple different types of epilepsy and seizures, and there is also a spectrum of disorders from even one gene to be affected. And luckily now we have lots of testing available for genes, so we can do a gene panel or test the whole exome sequence, and it is much more available and achievable. The second cause is structural etiology. So structural etiology means that there is an abnormal formation of the brain, how the brain was built, and it can be acquired, means you get it throughout your life, or it can be congenital, means that you were born with it and it happened in the womb when the brain was forming. Some of them can be a structure when the cells are forming, they do not form correctly and they do not align themselves correctly, and this is called cortical dysplasia, and there are multiple types of that. And sometimes the cells do not migrate all the way in the brain, and they call heterotropia. All of those are considered birthmarks, if you will, in the brain. And other acquired scars that you can get are from stroke, from trauma, from abscess, or any other malformations that you can get throughout your life, and those can lead eventually to seizures. And one classic example is hippocampal sclerosis that can be caused by febrile seizures in the early life. And the third one is metabolic. Metabolic is when the epilepsy is happening because there is a problem in the metabolism of some of the compounds that the brain needs to survive, or some compounds that accumulate and that is toxic and that can lead to seizures. One of the classic examples is the transport for glucose, the glucose not getting inside the brain, and that can lead to seizures and developmental delay. And the fourth one is immune etiology. The immune etiology means that there is inflammation in the brain that leads to disruption in the brain function, which leads to seizures. These are considered autoimmune disorders, means that the immune system is confused and attacks the brain. This can be just an autoimmune disorder by itself, or it can be a response to some cancers, and it is called paraneoplastic syndrome, when there is a cancer in the body, in the stomach or in the lungs or anywhere in the body, and that can provoke the immune system to attack the cancer, and it gets confused and attacks the brain and the cells as a side effect. And one of the classic examples is in that movie, Brain on Fire, which there is a lady that she had probably some ovarian cancer or ovarian teratoma, and that led to attacking the brain, and she had psychiatric changes and she had seizures. And let me know down in the comments, what seizure types do you know of and what are the causes that you are experiencing? And the fifth one is infectious, when the seizures are caused by some kind of infection attacking the brain, like meningitis, encephalitis, and even COVID-19 can cause seizures. And this is what we found myself and my team in when we did studies on the effect of COVID-19 on the brain, and we found lots of patients can have new onset seizures because of COVID-19 infection. And globally and internationally, infections are the leading causes for epilepsy, such as HIV, neurocysticercosis, malaria, and tuberculosis. And the sixth one is unknown etiology. Unknown etiology means that we do not know what is the cause of epilepsy, and it is pretty common. We face this in 30 to 50% of the seizure types, and this can be because the cause of seizures is too small to be picked up by the scans that we do, or it can be taking time to show up on testing. But this can be a good sign that if we see everything normal, that means that maybe the epilepsy will be better controlled than others. And yes, you can have epilepsy with everything, all the testing are normal. And this can be seen in many cases because epilepsy is a clinical diagnosis, depends on how you describe the events of seizures to your doctor. And we can make the diagnosis of epilepsy clinically based on our history and physical exam alone. And sometimes we only see the changes when we take the brain out in a surgical treatment and look under the microscope and see those very small changes that can be the cause of epilepsy. All right, now we know all the causes of epilepsy. Let's arrange them by age, because that's very, very important, and it can be different between one age group to another. In children and young ages, the most common cause of epilepsy is genetic disorders, and it can be also due to many syndromes that happens in early life, and it can be due to infections or lack of oxygen to the brain. And then we have a steady state of epilepsy throughout life, and then there is a huge peak after age 65, and most of these cases are caused by acquired conditions such as stroke, brain tumors, traumatic brain injury, and neurodegenerative disorders such as Alzheimer's disease. You know that you can control your seizures and get rid of them. And to do that, you can see this video and stay healthy, and see you in the next one. Salam.